Mr. President, if you're in a shaky financial situation wondering how you're going to meet your obligations, the first instinct isn't generally to wildly increase your spending, unless, of course, you're a congressional Democrat. Our nation's Medicare system is on shaky financial ground. And Democrats' answer is to massively expand the program to the tune of trillions of dollars. Mr. President, 2 weeks ago, the Social Security and Medicare trustees released their annual report. According to the report, beginning in 2026, Medicare will not be able to meet its obligations. But this doesn't even seem to register on Democrats' radar. They steamroll right past the program's already shaky financial status and ask the American people to believe that somehow massively expanding the program to include almost the entire U.S. population at a price tag of staggering proportions will just work. It's difficult to overstate just how unrealistic Democrats' Medicare for All fantasy is. Start with a price tag, $32 trillion over 10 years. $32 trillion. To put that number in perspective, Mr. President, that's more money than the federal government has spent in the last 8 years combined on everything. And that $32 trillion estimate is likely too low, as it was based on an earlier version of the senator from Vermont's Medicare for All plan. His new plan also includes a massive new benefit funding for long-term care, an enormously expensive part of the healthcare system. Democrats' last attempt to have the government run a long-term care program fell apart before it was even implemented because the program was not financially viable. But let's leave aside the tremendous cost for a minute and the tax hikes on ordinary Americans that would be required to pay for it. And let's talk about the massive difficulty of implementing such a system. The junior senator from Vermont expects people to believe that the government can successfully transition more than 180 million people off of their private insurance and into government-run health care in 4 years. 4 years. To put that in perspective, the Obama administration had 3.5 years to implement the Obamacare exchanges, which were intended to cover a tiny fraction of the number of people who would be covered under Medicare for All. As I'm sure most Americans remember, the government couldn't put together a working website in that 3.5-year time period. And yet Democrats somehow expect us to believe that they can smoothly transition 180 million Americans into government-run insurance in just 4 years. We're also somehow supposed to believe that things will be much more efficient with government running your health care. Now, it's certainly true that there's a lot of bureaucracy in our current health care system, but I'm fairly sure, Mr. President, the answer is not giving control of health care to the mothership of bureaucracy, the federal government. Democrats also apparently expect Americans to believe that the federal government will be able to deliver almost unlimited health care for free. Unfortunately, no matter how much money the federal government takes in with higher taxes, there will eventually be a limit to how much it can spend on health care. And what happens when it can't afford to meet demand, which, by the way, tends to increase substantially when something is offered for free? Well, I'll tell you what happens, Mr. President. Long wait lines and rationing of care, which have become the hallmarks of socialized medicine in other countries. Mr. President, there's no question that our healthcare system is not perfect. And Republicans are currently working on legislation to address some of the healthcare challenges facing Americans. But destroying our current health system to fix the problems we have would be like razing a house to the ground to fix a leak in the bathroom sink. There are lots of good things about our healthcare system and a lot of people in this country who are happy with their healthcare. We need to preserve the good things about our system and fix what is not working, not force everyone into a fantastically expensive, one-size-fits-all, government-run healthcare system that would reduce everyone's quality of care. The Democrat chairman of the House Rules Committee, discussing a House hearing on Medicare for All, recently said, and I quote, "It's a serious proposal that deserves serious consideration on Capitol Hill, end quote. Well, Mr. President, I would argue it's the exact opposite. The only thing that's serious about this proposal are the serious consequences it would have for the American people if it was ever implemented. And it is deeply irresponsible of my Democrat colleagues to peddle this government-run nightmare as a legitimate health care solution. One of our former colleagues, Tom Coburn, used to say, if you think health care is expensive now, wait till it's free. Let's hope, Mr. President, the Democrats decide to take a more serious approach to health care reform before Americans are forced to live under the ugly reality of their socialist fantasy. Mr. President, I yield the floor.